My name is Dr. Ayodele Irinle, and I am one of the nephrologists here in Gallup. I've been in Gallup for the last 14 years, and as part of my role in the community, I provide general and interventional nephrology service to the community through the High Desert Nephrology Associates. Also in the hospital, I am the current chief of staff with the Rehoboth McKinley Christian Hospital, and it's been a great pleasure just working in this community and helping out, with the folks around here.
So we have such a phenomenal group of faculty that are really committed to helping students and residents find their passion, and really hopeful that some of that involves work in rural New Mexico and in rural communities. As I mentioned, the population we serve is fantastic to take care of, and really interesting from a cultural perspective. We see about 70% Native American patients, primarily Navajo, also some from Zuni and some of the other surrounding pueblos, and really an interesting group to learn about, and absolute privilege to serve.
Here in Gallup, the community is awesome. Everyone is very welcoming. I have not felt out of place. I have not felt like homesick at all being here in Gallup. Everyone is introducing themselves, they're excited for us to be here, and it's just a great, amazing experience to be here in Gallup.
It's just you and the preceptor for the most part. We have residents here, but I find the most rewarding aspect of this training, specifically in Gallup, to be the fact that you get to talk to the patients, you get to be with the physician, and you're the first in line to do procedures. You have a lot of autonomy. So that's really rewarding.
I was just, so impressed how welcoming everyone was and how much they treated me as part of the team. On grand rounds every morning when we were discussing the patients and the patient care, I was frequently looked to for any suggestions or advice I would have about the patient care, whether that be during the stay or transitioning to rehab facilities afterwards and things like that. Even, the notes that I was writing for patients, which really I thought only my preceptors were reading, were actually being read by the entire staff. And I've had staff approach me and ask me about some of the things I wrote in there and how I felt about, the patient care. So that was very interesting. It felt so good to, be a doctor.
You will see patients in the chronic kidney disease clinic, where we manage, hypertension, CKD, all stages from 1 to 5. You will see procedures at the Access Center, which is where we are right now. You will see things like angiograms, putting in tunneled catheters, doing kidney biopsies, replacing tunneled catheters, putting in stents, doing angioplasties. Those are things that you would typically expect a huge, big tertiary center to do, but we're doing all of that in Gallup. In the hospital setting, you will learn everyday skills, like putting in central lines, to assist patients who are going to be doing emergency dialysis. You will learn about the modalities of dialysis, including peritoneal dialysis, hemodialysis, as well as the skill and art of very basic skill and art of taking the history and the physical, and then looking at the clinical science that you have to put everything together to make one big diagnosis.
It was always rewarding to me to see how grateful they were to be able to receive healthcare, professional healthcare. And many of them also shared with me the challenges that they face. For example, traveling to the healthcare facilities because maybe they don't have a ride, or the roads are just not good, or they don't even have ancillary services like CT scans to be able to get diagnostic tests done.
I've been able to suture up several wounds. I did a staple on a scalp laceration. I performed a lumbar puncture. I've done ultrasounds on both early pregnancies and of the heart. I've been able to also ultrasound abscesses, and then I've been able to do an IND, which is just incision and drainage. And then those patients who I do the IND, they come back to see me, and I'm able to pack it and check on the wound. So I've been able to perform all of those just in the 3 weeks I've been in the emergency department.
Advice is what I would say: start early, start slowly, early. There is no such thing as like too early. There is such a thing as too late. Do your research. Sometimes it can seem like overwhelming, like whatever you are like trying to do. Like I have no idea where to start. Like I have zero information, like zero. Just, I mean, like right now, Google it, and you probably will not like find the best resource right away. But like the more you read, the more you talk to people, the more you make connections and ask for help. And people are willing to help. Like don't think that they're not. The better you will be off, and yeah, just like step by step, each day you will get closer to your goal.
I'm really excited to say that I think the students, as far as I can tell, universally have a really, really good experience here in Gallup. It's a beautiful place. If you can see out the window here, it's a fantastic place to spend some time. Tons of great things to do outdoors. We're at a little bit of altitude, so it's cooler than Las Cruces or Albuquerque, and just a really beautiful place to spend some time. It's a small town, and you really get a chance to see what rural living is like when you spend some time here in Gallup.